Hi, it's Bill, the knee pain guru, and welcome to today's video. Today we're going to talk about, the topic of today's video is going to be about how to get rid of knee pain fast. We'll be answering questions after the short presentation, so if you have questions, a little bit more than hi, put them in the comments section on the side and we will address those. Whatever you have as far as your knee pain, your diagnosis, working with doctors, physical therapists, whatever it is, it's all, please, stem cell therapy, shots, prescription drugs you're taking, whatever it is, we want to put that on the table and look at all your options, figure out a strategy best for you to get out of pain the fastest. And make sure to like the video, give it a thumbs up, like and subscribe to my channel. Turn on notifications so you're aware of future videos that I do. I do 2 of these a week, one on Mondays and one on Thursdays. Also share this with your friends. You'll be able to identify those, the ones that limp. They're easy to spot. Okay, so now we're going to get into how to get rid of knee pain fast. It's a very common question, especially when you're in pain. That is what you want to do the soonest and the quickest. So the biggest challenge that I've found over the past 20 years, since my own knee injury, dislocated my left knee 4 times, had reconstructive surgery on the ligament in my left knee, tore 2 pieces of meniscus, had that removed as well. So I've been through the ringer as far as what the medical model had to offer. And on the other side of that, I still had a lot of issues with my knees. So this is 20 years of both personal experience as well as working with thousands of clients in that time period. And the biggest challenge that I have found, both in myself and with working with clients, is like this internal compulsion. That's the best way I could describe it, is this internal like desire to do things to make the knee hurt worse. I know it sounds silly. I know it's like, oh, Bill, I thought you're going to give me something deep. And this is actually very deep because it forces us to look at the patterns that are going on. It was forced me to look at my patterns, what I was doing to put my knee in pain. It's also going to challenge you as well. So, and doing things like exercise, golf, tennis, softball, hiking, running, doing things that actually put the knee in pain more. Things like stretching, things like chores, doing errands. And I found myself doing those things that actually put my knee in more pain in the process. And I'm going to give you a technique here in a little bit that's going to show you exactly how to eliminate a lot of those things so you can get your knee pain, reduce your knee pain fast. So the first thing is to stop doing things that make your knee hurt. We already covered that to some degree, but I want to go into this point a little deeper. This is the second piece to it. Accept this reality. And this is a reality many people with knee pain struggle with, myself included when I had it. Is accept the reality that making the knee hurt is going to move you further from getting out of pain. Like the straightest distance between 2 points, or the shortest distance between 2 points, is a straight line. But if you're making the knee hurt, you're actually moving in the opposite direction. You're actually causing your knee to hurt worse, which is not moving you out of pain. So when we can wrap our brain around this concept, now we can begin to work with the underlying patterns that are causing what's going on with the knee. So what I want you to do, and you could do this now if you're watching the replay, pause the video. And what I'd like you to do is list all of those things that you do that make your knee hurt. So for me, it was going to judo, it was lifting weights, it was biking, it was running, it was just walking. There was a whole list of things that my leg was fatigued, it was tired, just the knee scar would sweat, it would just be awful. And I have you make a list of all of the different things that you do throughout your day. Maybe keep a little pad of paper and a pen with you and jot down all those things that you do when the knee hurts. And then at the end of that day, begin to rate those things that are very important as well as those things that are not important at all. So those things that are very important, put a 10 in front of those. So things like going to the bathroom, let's say. It sounds silly, but it's important. It's super important that you be able to ambulate yourself to the bathroom, go to the bathroom. So that's super important. You can't really get around that. And other things like maybe walking the dog or taking the garbage out, not so important, not so urgent. So you would put maybe a 2 or a 3 with those at the bottom there. And you're going to have this list of different things that you do throughout your day that are causing your knee to hurt. And as you rate them, you're going to see, some of these are way more important than others for me to do. And you're going to begin with those that have a rating of a 5 or lower, begin to eliminate those things from your day. Meaning, sometimes people like weeding. Is it so urgent that you get the weeds out of your garden? Some people may be more important, others not so much. But what you're going to find is that you're doing things throughout your day that cause your knee to hurt that you really don't have to do. So those things that are 5 and lower, you could begin eliminating them or doing them less. Those items that are like a 6 to 9, you could begin to see if maybe you can get friends or family members to help you with those things. And what that'll do is that'll kind of get you out of the equation, get your knee out of the equation to put it in pain when you felt you were the only one that was going to need to do it. And obviously those things that are like 10, super important, like going to the bathroom or getting to the kitchen to feed yourself or whatever that is, those are things that are absolutely essential for you to do. Then do those. But what we're going to do is we're going to start eliminating those things from your day that are causing your knee to hurt unnecessarily. And it may sound super basic and super simple, but what it does is it starts ramping up your body's ability to start healing yourself. The longer your knee is not in pain, the faster it's going to heal. This is not only Bill throwing out good ideas. This is a neurological state that exists in your body called a parasympathetic state that parasympathetic means rested and relaxed. The opposite of that is sympathetic, which is fight or flight. So the longer your body is in a parasympathetic state, the faster it's going to be able to heal. Because all of the mechanisms for your body to be able to heal your knee come online. So the more you cause pain in your knee, the more things you do throughout your day that cause pain in your knee, the more it pushes your body into a sympathetic state or a fight or flight state, which shuts down all those mechanisms that allows your body to heal itself. Is this making sense? Okay, so we're going to begin eliminating those things from your day that are needlessly causing your knee to hurt. If you've got questions, please place those in the comment section over on the side, like and subscribe to the channel, and turn on notifications for future videos. Okay, now we're going to go to the third piece. Third piece is beginning to learn how to create comfort in your knee. So this is next level stuff. We've started eliminating those things that are causing pain, that are contributing to your knee hurting. Now we're going to begin to increase those things that create comfort in your knee. And there's a specific way of doing it, but at first I want to outline what comfort is not. This is a big thing. This is a drastically different approach than what you've been used to, most likely. So comfort is not the hurt so good feeling. This is not like, oh, your knee is bugging you, so you do like trigger point therapy or deep tissue massage or something in and around your knee or your leg that gives you that hurt so good feeling. Like it's like taking your breath away and you're kind of holding on with white knuckles as you're dealing with that experience. Comfort is not that. It's not the hurt so good feeling. Comfort is not pushing through the pain. No pain, no gain. Pain is weakness leaving the body. Push through the pain. It is not that. Comfort is not that. You'll frequently experience this when you go to conventional physical therapy or a conventional physical therapist. They will try to push your knee, push your leg through the pain in the hopes that some way it will get you out of pain. Remember the beginning of the video, anything that's causing pain is moving you further away from being out of pain. Anything that causes you pain is moving you further away from being out of pain. And another piece as far as what comfort is not sitting on your butt and doing the conventional RICE therapy. RICE therapy is rest, ice, compression, elevation. That is valuable and good, but this is not what I'm talking about. Comfort is not any of those things. So let's go over that again. Comfort is not the hurt so good feeling. Comfort is not pushing through the pain. And comfort is not sitting on your butt on the couch with your leg propped up on a pillow with a bag of ice wrapped in an ace bandage. It is not any of those things. Comfort is talking specifically about working with the intrinsic movement of the joint that is causing the pressure on the nerves in the knee, causing the pain. So you have a nerve in your knee that is being squeezed, sending a signal to your brain that you have pain. The more the squeezing, the more the pain. So the more you create pain in your knee, the longer your knee is going to hurt, and it reinforces this pattern not only in your knee and your leg and your body and your mind. It reinforces this pattern in how you live your life. Because the body doesn't want to experience pain. It does a workaround. So when we create comfort in there, we're getting the pressure off of the nerve in the knee. A normal reflexive response to experiencing the pain. When we get the pressure off of the nerves in the knee, we send this cascade of relief in the knee, in the leg, in the body, and in the mind. So it sets up the conditions so your body can begin to recover. This is deep stuff. This is not surface level, like give me the exercises or stretches to get my knee out of pain. This is much deeper, much more intricate, and it's tapping into your body's ability to heal itself. So let's go over those 3 points again for how to get rid of knee pain fast. First is, you're going to stop doing things that make your knee hurt. You're going to accept the reality. Accept this reality that making your knee hurt in any way is moving you farther away from getting out of pain. And then the third one is look for the way, understand, begin to learn how to create comfort in your knee by getting the pressure off of the nerves in the knee that are causing the pain. So you're like, okay, Bill, how do I do that? Are you going to demonstrate it on the video? No, I'm not going to demonstrate it on this video because it's too easy for you to leave. I want you to go to my website and I want you to go into my 7-day training that is going to teach you how to do this. No cost, no obligation to you. If it works, great. Or you begin to understand and experience how to tap into the power of comfort in your nervous system. If you don't feel anything or it does nothing for you, no harm, no foul. You go your way, I go mine. No big deal. So I will put a link in the description to that website. If you have questions, and this is a 7-day knee pain reduction challenge, you can go take that right now or begin taking it right now. If you have questions about what's going on in your knee, please enter it over in the comments section. And I want to touch on another thing. The reason why I'm not giving you the stretch on how to do it right now is because this is going to vet out a lot of people. This is going to remove a lot of people from the equation who are looking for a quick fix. And a lot of times, if you've been in pain for months, years, some clients that I've worked with has even been decades they've been in pain. That little quick fix isn't going to do it. It's not going to be exercises and stretches. It's a mindset change. It's a journey, not a destination. And I want to remove those people from this equation so those that show up on my website truly want to get out of pain. Fair? Okay. Let's see. Lavuzda says hi. Hi. I'm not quite sure where to go with that, if anywhere. But there you go. Okay, let's see. Sushma says, starting stage of knee osteoarthritis. If I took supplements which contain animal products, it will help. Please suggest. It can. It's difficult to say because we're not addressing the tension pattern. That is osteoarthritis. Let's take a step back and look at a bigger picture through the lens of comfort and what is going on in the knee when it's experiencing osteoarthritis. You have that nerve irritation that we were talking about. The nerve is being squeezed in the knee, causing the knee joint to squeeze closer together. Just like when something hurts, you clench your jaw. Or you pull your shoulders up towards your ears. It happens when the body experiences pain. So when your knee experiences pain, the same thing happens in the knee. Your knee squeezes closer together. The tension goes up into your hips and lower back. It goes up and down your legs. That's why you feel so fatigued throughout the morning, even if you've had a good night's sleep, as good as you can have with knee pain. Your body is constantly in this fight or flight state, so it gets fatigued easily. So when you're in the starting stages of osteoarthritis, you have a tension pattern that's going on in the joint, causing the nerves in the knee to be squeezed. When this tension pattern happens in the knee, in the case of osteoarthritis, it happens in all knee pain, as a matter of fact, it squeezes out the synovial fluid in the joint. Well, what is the synovial fluid in the joint there to do? It's there to lubricate the joint so the joint it glides smoothly. The bones in the leg are there to slide smoothly over the meniscus, which is the cushion between the bones in your leg. Well, now you got the squeezing going on from whatever, accident, injury, trauma, surgery, whatever has happened to your knee. You tripped or you stumbled or you slipped on ice, or you fell on a curb, off of a curb, or whatever the case is, your body tensed up to protect itself. Now this tension pattern is causing the synovial fluid in your joint to be squeezed. Your joint to squeeze, and it squeezes out the synovial fluid, which causes the joint to dry out and be more painful. The more pain your knee joint feels, the tighter it gets. Guess what happens? Arthritis gets progressively worse. The more pain, and the longer you're in pain, the longer the joint is squeezing, the drier it gets, and osteoarthritis gets progressively worse. The joint begins to wear. It wears on the cartilage. It wears on the meniscus. Quick anatomy, and meniscus is between the bones. The cartilage covers the end of the bone. And what ends up happening is the longer it's dehydrated like that, the more painful it gets, the faster it wears. So, sure, you could take animal products. Sure, you could take glucosamine, MSM, and chondroitin. Sure, you can get rooster comb injections and platelet-rich plasma injections and stem cell injections. I mean, like laundry list, because the technology is there. But what aren't we addressing? The underlying pattern in the joint that's causing the joint to squeeze closer together and dehydrate it. So you're kind of wasting money on supplements and injections and all the other things that are going on because there's no room in the joint. That pattern is not being addressed inside the joint itself to relax the joint. Is this making sense? Sushma? Anyone have any other questions? Is this, because this is important. If we're just going to look for a quick fix and take some supplements, then go ahead. You don't need to ask me about it. You can try it yourself. You can test it yourself. But if you're looking for a long-term solution for what's going on, and here's what happens. A person like Sushma, who is only looking for the quick fix, the supplements to take so they don't have to deal with the underlying pattern, what ends up happening is this year they have the starting stages of knee arthritis. Knee starts hurting worse. They continue. They go to physical therapy or they go to exercise their legs to make their legs stronger. And what ends up happening is they have a dysfunctional pattern going on in the knee joint to begin with. And that dysfunctional pattern gets worse because now they're just strengthening the dysfunctional pattern by going to the gym and strengthening the weak muscles. But there really aren't weak muscles. There's other muscles that got too tight. So now the joint wears faster. They're still taking their supplements. They're trying really hard because they're taking the supplements. They're going to the gym. They're going to physical therapy. They're paying good money to get good support. But what ends up happening is the joint starts wearing more. So they're throwing up their hands. They're like, oh, nothing works. But they're going in the opposite direction. The fastest way to get out of pain is to create comfort. We want to create comfort to get out of pain. If we create pain, that's going to move us further away from the relief in the knee that we want. So we have to zoom out and look at the bigger picture. If you're looking for that quick fix, I'm not your guy. I'm not going to be able to help you because I want to make sure we have a solid foundation for you. So when you move forward, you're going to go back to the doctor or the PT when you have your checkup, and they're going to be amazed because you're tapping into your body's ability to heal what's going on. Not this flash in a pan, quick fix, throw it against the wall and see what sticks. We're looking for long-term solutions. Okay. Let's see. Wyoming trout. Okay. I am 60 and have a lateral tear. How do I create comfort so I can golf again? Wyoming trout. I would watch the replay of this video first and then go to the link right above your comment, thekneepainguru.com, and take my 7-day knee pain reduction challenge. I will post other videos on on meniscus tears because not all meniscus tears are created equal. The direction of the tear, the degree of the tear, the severity of the tear, like the length of the tear, is all going to be different. Understanding how much pain is being caused in your knee by the tear, how often that is, those are all things that take into consideration. Do you want a surgery or not? And if they do the surgery, can they repair it or do they need to remove the meniscus? So there's a lot of factors that go into understanding your strategy, what's going to work for you. Understanding, like, does it hurt? Are you a righty or are you a lefty? Does it hurt when you start to swing or does it hurt when you follow through? All of these are different tension patterns that are going on in your knee, in your hips, in your lower back, in your body. Does it hurt when you walk? Does it only hurt when you golf? Does it hurt going upstairs, going downstairs? So the depth at which we're going to look at how to get you out of pain is way more intricate than it's just not surface stuff. We have to gather as much information as we can about your situation and scenario to strategize what is the best way to get you out of pain. Does that make sense? I mean, like, let me know if that's landing for you. This is so we need to look at a lot more factors that are going on. Yes, you can. You can go to my website, go to the same link. I have a class coming up, a day workshop that is taking place in the Asheville, North Carolina area in June 22nd. And I also have private and group coaching programs where I work with clients. So we can go over all of these things, get it all lined up. And you ultimately, and this is what's really important with working with any client, is I want you to feel empowered with the knowledge and understanding of what's going on with your body. I could lay out a template, but it doesn't work for you. Then what are we doing? It's got to work for you. It's got to be functional. Yes, let me give you a I'm going to give you an email address. Send me an email right away. Send me an email, and what I will do is send you a link. We will get on a call, and we can figure out what works for you. So I'd be happy to entertain that conversation. But what's most important across the board is as we lay this out, I want you to understand all your options. And then we have to take all those options and see what really works for you, because not all options are going to work for you. There's people that are I work with clients that are in their 20s, their 30s, their 40s, their 50s, their 60s, their 70s. My oldest client was 89 and a half. And what ends up happening is they all have different priorities. It's not going to be the same across the board. A person in their 20s that has a torn ligament, that was me, is not going to want to have the same approach than someone in their 70s that just wants to live out the rest of their life comfortably. Completely different priorities and strategy. So we have to take that into consideration. And Wyoming Trout, please reference this video so I know. So we got to, what am I trying to say? So that I know it's you. Okay, we're going to wrap it up for today. I thank you all for being here. I see someone just joined as of recently. If you have questions about what's going on with your knee, please enter that in the comments section. Give the video a thumbs up, like and subscribe to my channel, as well as turn on notifications for future videos where I talk on different topics on how to get people out of knee pain, strategy to understand different diagnoses and situations with physical therapy. I'm going to sign off for today. Next video is going to be on Thursday. That is going to be the 6th. And I will see you then. Thank you so much. Have a great day, and I'll see you in the next video.